Hey future nurses, welcome back to Scrub and Spoon. How are you all doing? This is your nurse here. I hope you are doing great. Now today's Nclex review is on COPD and pneumonia. I also made a detailed video explaining the difference and everything you need to know with Nclex tip on COPD and pneumonia on my YouTube channel, so check it out. Now I just want to appreciate you all for your support always. Without wasting too much of our time, let's go. Do not forget to subscribe, do not forget to like, comment the best part of this video in the comment section. All right, now let's go. A patient with COPD is receiving oxygen at 4 liters per minute via nasal cannula. The patient becomes increasingly drowsy and confused. What is the nurse's best action? A. Increase the oxygen to 6 liters. B. Place the patient in Trendelenburg position. C. Decrease oxygen to 2 liters per minute and notify the provider. And D. Suction the patient's airway. Guys, the right answer is decrease oxygen to 2 liters and notify the provider, because COPD requires low oxygen. If you increase their oxygen, it will suppress their respiration and it will actually be difficult for them to breathe. So that's why the right answer is to decrease the oxygen to 2 liters per minute and notify the provider. Because look at the signs and symptoms they are experiencing: drowsy and confused. This is showing signs of hypoxia, because high level oxygen can suppress their respiratory drive, make it difficult for them to breathe, and now they will be retaining more CO2 and drowsiness. That's why they are feeling drowsy and confused. The oxygen was too much for them, and it's doing the opposite effect, making it hard for them to breathe. And when there's no proper gas exchange, especially patient with COPD, remember, emphysema, patient with COPD is like an umbrella, right? That contains chronic bronchitis, that is inflammation and mucus in the lungs, and emphysema, that is the tiny hair sac, which is the alveoli in the lungs, is damaged. So now they are having difficulty to breathe, they are retaining more CO2 in the lungs. Okay, and that's why the answer is to decrease the oxygen, and once you put them on low flow oxygen, they'll be able to breathe properly. So let's go through the wrong choices. Increase the oxygen to 6 liters per minute. That will actually worsen the CO2 retention, so you don't want to do that. It will cause difficulty breathing for them, so that's wrong. Putting them in Trendelenburg position can worsen the situation, so you don't want to do that. And D, suction the patient's airway. If there is secretion present and they are unable to cough it out, yes, get the suction ready to suction their airway. But if secretion is not there, there's nothing to suction. Okay, I made a video about it, so go watch it. Now let's go. Which assessment findings require immediate intervention in a patient with pneumonia? Pneumonia is an infection of the lung that causes inflammation and fluid buildup in the alveoli, making gas exchange difficult. Okay, now temperature of 101 Fahrenheit, 0.8 Fahrenheit. This is like 38 degrees Celsius, right? Productive cough with yellow sputum, respiratory rate of 32 breaths per minute, and fatigue and malaise. So the findings that require immediate intervention here is C, respiratory rate of 32 breaths per minute. Guys, I always tell you, airway breathing and circulation, that's what you use for your prioritization. And whatever, remember, when they ask you require immediate intervention, that means an unexpected findings, right? If you want to know which one assessment finding require immediate intervention, you will have to intervene immediately to an unexpected finding, or any finding that is likely to kill your patient or send them into critical condition, right? So look at respiratory rate of 32 breaths per minute. That is high. That is our right answer. It is very high. You need to intervene. Now this is indicating respiratory distress, right? And maybe impending failure of the lungs. So this needs to be intervened immediately. Is our priority. Now let's go. Temperature of 101.8. This is like 38 degrees Celsius. 38 degrees. Fever is expected because they have pneumonia. Pneumonia is an infection, right? So a patient with infection can have fever, so this is like expected. Now, productive cough with yellow sputum. This also indicates infection. When they have pneumonia, they have productive cough with flames, with yellow, green, or rust color sputums. So this is indicating they have infection. So, and they are saying the patient already have pneumonia. So this is indicating and confirming the pneumonia they have. Fatigue and malaise. It's also common symptoms. It's not urgent. The only urgent one, because guys, look, if they are not breathing, every other intervention is in vain. Their respiratory rate is high, and this can lead to complications. So that's make our answer right? Now let's go. A nurse is caring for a COPD patient who reports increased shortness of breath and has a barrel chest. Which is the priority nursing diagnosis? Nursing diagnosis, your fundamentals of nursing. Ineffective airway clearance, impaired gas exchange, activity intolerance, risk for infection. Now the right answer is B, impaired gas exchange. Guys, how are you gonna do this? Look, they have COPD, and COPD is a long-term lungs disease that makes breathing difficult, right? So now they have COPD and they have increased shortness of breath and barrel chest. Your priority nursing diagnosis will be impaired gas exchange because they are having difficult breathing. And guess what? When they have barrel chest, a patient with COPD will have barrel chest. Why? Because in COPD, like I said, gas exchange is difficult. That's inhalation and exhalation of air, right? And this is because it's difficult for them because they are able to inhale air, right? Oxygen. But it is difficult for them to exhale air out because all the air they inhale, not everything will come out because this air is now trapped in the alveoli, the tiny hair sac in the alveoli in the lungs. And this air that is trapped, because they are supposed to, you inhale oxygen and exhale CO2. Now, this air is now CO2, but it is trapped in the alveoli. It can't come out. So they have, patients with COPD have difficulty breathing, difficulty exchanging gas exchange. And that's why. Your nursing diagnosis for COPD. Remember, this is impaired gas exchange. Now, let's talk about ineffective airway clearance. They can have nursing diagnosis of ineffective airway clearance if they are unable to clear their airway or they have a lot of secretion in the airway, right? That can be your nursing diagnosis. Activity intolerance, there's really nothing. Yeah, when you have COPD, you get tired quickly. But with the signs and symptoms presented to you, you cannot say that's activity intolerance for nursing diagnosis. And the last one, risk of infection. That's risk of infection. The signs and symptoms presented to you is not leading to risk of infection. So how can you say that is your nursing diagnosis? How can shortness of breath and barrel chest be a nursing diagnosis for risk of infection? How is that possible? So get it right. Now let's go. A patient with pneumonia is receiving IV antibiotics. Which finding indicate the treatment is effective? We are looking for therapeutic effects of IV antibiotics, right? White blood cell count increases. Temperature remains elevated. Lung sound remain crackling, and D, oxygen saturation improves. The right answer is D. Oxygen saturation improves. So guys, let me explain this to you. They have pneumonia. Like I said, pneumonia is an infection of the lung and it makes breathing difficult, right? And they are receiving IV antibiotics. Now they're asking for findings that will indicate that the antibiotic they are taking is effective. Now, the right answer is oxygen saturation improves because improved oxygenation shows resolution of inflammation and infection. Okay, it shows that if the oxygen is improved, it shows that they have inflammation. It shows that is been clearing out, the fluid is almost drying out, and now they can breathe properly. Now let's go through the wrong choices. White blood cell count increases. What does that tell you? When the white blood cell count increases, it shows there is presence of infection. It shows infection and not therapeutic effect of antibiotics. Actually, when they're taking the antibiotics, the white blood cell is supposed to be on the normal range. That is when you will show that, okay, with white blood cell, the antibiotics is giving therapeutic effect. So the white blood cell should be in the normal range. But increased white blood cell count signifies or indicates presence of infection. That's why the answer is wrong. Temperature remains elevated. That is still signs of infection. And we are looking for therapeutic effect of receiving IV antibiotics. So this is not showing that the antibiotic, elevated temperature is not showing that the antibiotic is actually working or giving therapeutic effect. Now, lung sound remain crackles. It's still showing that the issue is still ongoing. They have fluid still build up in the lungs. So that's not therapeutic effect. Because look, from A, B, C, all these choices are showing presence of infection, showing they still have the pneumonia. But the only one that has positive effects is oxygen saturation improves. Okay. Now let's go. A COPD patient is prescribed theophylline. Which lab value should the nurse monitor? A, PT/INR, B, theophylline level, C, potassium level, and D, creatinine level. Now, the right answer is theophylline level. Now, theophylline has narrow therapeutic range between 10 to 20. So, if they are taking theophylline and their theophylline level is high, it indicates theophylline toxicity, and that can cause cardiac arrhythmias, cardiac dysfunction, or dysfunction of the cardiac rhythm. And theophylline toxicity can also lead to, like I said, it can lead to cardiac arrhythmias and seizure. And that's why you need to monitor. When they are on it, you have to monitor theophylline level. And for you to also understand it well, theophylline is an older medication that is used when inhalers don't work. It's a bronchodilator. So theophylline is a bronchodilator, right? It is used when other inhalers, didn't work. When other bronchodilators didn't work, then they can resort to theophylline. So you have to monitor theophylline level. Now let's go through the wrong choices. PT/INR. You monitor this for warfarin. When your patient is on warfarin therapy, that's what you have to monitor. Potassium. You have to monitor potassium if your patient is taking maybe ACE inhibitors because they cause hyperkalemia, high potassium. If they are taking furosemide, because furosemide loop diuretics, they lose potassium. You monitor potassium. Creatine for kidney function. Okay. Now let's go. A nurse teaches pulsed lip breathing to a COPD patient. What is the expected outcome? Now they're just asking you that. What is the function of that pulsed lip breathing they are doing, right? Reduced need for oxygen therapy, slowed respiratory rate and improved exhalation, increased sputum clearance, and enhanced inspiratory volume. Now, the right answer is B, slowed respiratory rate and improved exhalation. Let me explain something to you guys. When a patient has COPD, like I've been saying, just like the question asks, the nursing diagnosis for it is impaired gas exchange. They have it difficult. It's difficult for them to breathe. It is difficult for them to exhale the CO2 that was inhaled as oxygen, right? Because now it is trapped in the alveoli in the lungs, right? And now what the body does to compensate, because now they are the barrier chest, because they are retaining a lot of CO2. The air is trapped in the tiny sac, the alveoli. Now the body wants to compensate this by increasing their respiratory rate for them to quickly breathe in oxygen, because they have too much CO2 in the system, in the body, trapped in the lungs, right? And that's when barrier chest coming. So the body trying to compensate by causing them to breathe in quickly, breathe in more oxygen quickly. And that's why with patients with COPD, they will have increased respiratory rate, but not too high. Okay? So, and the purpose of the pulsed lip breathing is to slow down the respiratory. Slow down the respiratory rate and improved exhalation, breathing out. Okay? Now let's go through the wrong choices. Reduced need for oxygen therapy. O2 need, their oxygen needs may not change because they are doing pulsed lip breathing. Okay? Increased sputum clearance. It is not related to clearing the airway or the sputum. It's just to help them breathe. Okay? And the last one, enhanced inspiratory volume. No, actually, pulsed lip breathing focuses on exhalation, not inhalation, because they will need to get out those oxygen, CO2, right? So not inhalation. It focuses on exhalation, not inhalation. Okay. Now let's go. The nurse hears bronchial breath sound over the left lower lobe in a pneumonia patient. What should the nurse do next? Now, document as normal finding. Encourage coughing and deep breathing. Administer antibiotics. Place patient in high Fowler position. Now, the right answer is B. Encourage coughing and deep breathing. See what's going on here. When the nurse listens to their lungs in the lower lobe, right? They hear bronchial breath sound. In the lower lobe, you are supposed to hear the normal breath sound, the vascular breath sound. In and out, you are supposed to be hearing the inhalation and exhalation of air. And that comes as a soft rustling sound. But when you hear bronchial breath sound, you'll be hearing a very harsh sound, and it's very visible. You can hear it clearly. For normal breathing, for normal breath sound, it's not supposed to be that clear. It's soft and rustling. But with bronchial breath sound, it's very harsh and loud. So, and this suggests that instead of breath sound, air should be there. Fluids or pulse is what is there, and that's why the sound is very harsh and you can hear it clearly. So this suggests consolidation. Instead of air, that's it. Normal breath sound should be there. You are hearing what is there is now fluid or pulse. So that's consolidation, right? So encouraging them to cough and deep breathing can help to clear the secretion that is there, right? Now let's go through the wrong choices. Document as a normal finding. That's not normal finding in the lower lobe. It's not normal finding. You're supposed to hear normal breath sound, not fluids. So that's not normal finding. Now, administer antibiotics. Antibiotics is used for fever, right? So, but that's not what they are having here. It's not related. It's not specific, okay, to the situation. Now, place patients in high Fowler's position. High Fowler position is supportive, right? It helps to breathe. But we are talking about the sound that was heard here, bronchial. They hear bronchial breath sound, right? That's what we are dealing with. And what should the nurse do is to encourage, to clear that secretion that's there, to encourage coughing and deep breathing, okay? Now let's go. Which finding indicates a potential complication of pneumonia? Okay. A, productive cough continues. B, dullness to percussion in lower lobes, restlessness and confusion. And D, mild pleuritic chest pain. Guys, the right answer is C, restlessness and confusion. This is indicative of hypoxia, that is low oxygen supply to the tissue, or sepsis, right? And that's why that is the right answer, and urgent intervention is needed. Now, productive cough continues. They have pneumonia, so they have productive cough of either phlegms, yellow, green, sputum. That's continued. That's expected, right? Dullness to percussion in lower lobes, also expected. Now, mild pleuritic chest pain. They have pneumonia, accumulation of fluids in the lung, inflammation is expected. Okay. Now let's go. A COPD patient is prescribed albuterol and fluticasone. What should the nurse, guys, pardon me if I'm not pronouncing these medications right, you know they are hard, guys. What should the nurse teach? Use fluticasone first, then albuterol. Rinse mouth after albuterol. Use albuterol before fluticasone, and D, avoid using both on the same day. Guys, the right answer is C. Use albuterol before fluticasone. Now they have COPD and they are prescribed these two medications. Albuterol is a rescue inhaler. It's a bronchodilator, right? It opens the airway in minutes, right? So it is a rescue inhaler. So that's the first thing they will use. And the next thing they will use is fluticasone, which is a steroid. It's a corticosteroid, right? Right. So that's what they will use after. So the order is albuterol first before fluticasone, if you can remember as AF. All right, you have to use the albuterol first to open the airway first before so that the fluticasone, which is a corticosteroid, can be absorbed, right? That's why the airway is already open and then it can be easily absorbed. Okay, now let's go through the wrong choices. Use fluticasone first, then albuterol. I just explained the albuterol come first before fluticasone, AF. Okay, now rinse mouth after albuterol. No. If you need to rinse mouth, you need to rinse mouth after fluticasone. Avoid using both on the same day. Both are used as prescribed, right? Both work hand in hand to help in COPD patients. Which intervention is most important after administering antibiotic to pneumonia patients? Encourage ambulation, monitor for allergic reaction, encourage fluid restriction, and D, monitor temperature hourly. Guys, the right answer is B, monitor for allergic reaction. Look at the question. It's most important after administering antibiotics. You need to know if they have any allergic to this prescribed medication. So you have to monitor for allergic reaction, okay? And that's why that's the right answer. So now let's go through the wrong choices. Encourage ambulation. Yeah, that is helpful, but it's not the first priority. Remember, they are just administering antibiotic. You have to understand what's going on in the question to understand your response, your answer. Now, encourage fluid restriction. Fluids are encouraged in patients with pneumonia because they need fluids to thin up those mucus. They need to thin it, so when you give them more fluids, it thin up those mucus. So fluids is needed. Monitor temperature hourly. Not as urgent. Yes, they have pneumonia. They might have fever because it's an infection, but not as urgent as monitoring for allergic reaction. A patient with COPD is prescribed Tiotropium. Which instruction is most important for the nurse to include? Take this medication at bedtime. Use this as a rescue inhaler. Do not swallow the capsule. Use only in the inhaler. And D, use before albuterol for better effect. And the right answer is C. Do not swallow the capsule. Use only in the inhaler. So this medication comes in capsule, but it has to be inhaled. So it will be put in the inhaler and it will be inhaled, not swallowed, because if you swallow it, it will not give you the therapeutic effects. It will not work, right? So you need to inhale it, and even swallowing it is unsafe. It's meant to be inhaled. Now, take this medication at bedtime. Timing is not specific with to bedtime, so you can take it anytime, not specific to bedtime. Now, use this as a rescue inhaler. It is not rescue inhaler. Albuterol is a rescue inhaler, and used before albuterol for better effect. It is not used with albuterol for acute symptoms. No, it is not. So that makes it wrong. Which action best prevents hospital-acquired pneumonia in older adults? A. Administering IV fluids. B. Elevating the head of the bed during meals. C. Encouraging frequent ambulation. And D. Performing hourly lung assessment. The right answer is elevating head of the bed during meals. Now, aspiration pneumonia is referred to as hospital-acquired pneumonia because this is gotten through when they are feeding. And aspiration pneumonia is when fluids goes into the lungs. Okay, especially if you have a patient on G feed and you start the pump, make sure their head is up, because if you lie them flat, that fluids that's supposed to go into the stomach can go into the lungs. So when your patient is on G feed, ensure their head is up. Okay, that makes the right answer. Elevate the head of the bed during meals. Now, administer IV fluids. Okay, A, C, encourage ambulation. Administer IV fluids, encourage ambulation. They are helpful but not effective in preventing hospital-acquired pneumonia, aspiration pneumonia. Okay, perform hourly lung assessments. Okay, it's also monitoring is positive, but it's not preventing aspiration pneumonia. The only one, because aspiration pneumonia is food going into the lungs, right, or fluids. The only one that's preventing is them elevating the head of the bed while you are feeding them. Right? A nurse assesses a COPD patient using accessory muscle to breathe. What is the best response? A. Encourage oral fluids. B. Provide bronchodilator therapy as ordered. C. Place in side lying position. And D. Suction the airway immediately. Now look at this. When a patient with COPD is using accessory muscle to breathe, it's showing respiratory distress. They are finding it difficult and they are using accessory muscle. You will see their ribs. If you're able to see, you see that they are using the accessory muscle to breathe. It's showing respiratory distress, and the right answer is to provide bronchodilators, because that will open the airway. Okay, therapy as needed. That will open the airway and it will help them to breathe properly. Now, encourage oral fluids. Place in side lying position. Suction the airway. Why is suctioning the airway? It's not like the secretion. So all of these are not immediate solution for respiratory distress, because they're experiencing, look at the signs and symptoms. Accessory muscle to breathe, they are experiencing respiratory distress. So you need to give them bronchodilators to open the airway, because it's like the airway is tightening up, it's closing up. So once it opens, they can have easy breath. They can easily breathe. Okay. Now let's go. A patient with pneumonia is ordered intensive spirometry every 2 hours. What is the main goal of this intervention? Prevent fluid overload, reduce fever, improve lung expansion, and prevent atelectasis, and D, decrease respiratory rate. Now the right answer is C, improve lung expansion and prevent atelectasis. Now, intensive spirometer helps encourage deep breathing, because they are blowing air into it, so that helps them to re-expand collapsed lung. That helps them to open the lung, to expand the lungs, right? Because atelectasis is collapse of the lung. So when they use intensive spirometer, helps to re-expand the collapsed lung, and that's why C is the right answer. Let's go to the wrong choices. Prevent fluid overload. No, that's not one of the reasons why they will prescribe or order intensive spirometer. Now, reduce fever. This is not antipyretics or acetaminophen, so it's not going to work for fever, right? Now, decrease respiratory rate. No. What can decrease respiratory rate in patients with COPD is pulse lip breathing. Pulse lip breathing, not this one, okay? Not intensive spirometer. Let's go. Which dietary instruction is best for a COPD patient with severe dyspnea while eating? That is difficulty breathing while eating. Now, drink fluids with meals. Eat large meals to conserve energy. Eat small, frequent meals in high calories. And D, limit fats and proteins, right? Guys, the right answer is C, eat small, frequent meals in high calories. First off, they need high calorie food. And second off, Small frequent meals help to conserve energy and oxygen. Actually, eating is an exercise and it consumes a lot of oxygen and energy. So when you encourage them to take small frequent meals, they take it slowly, so that conserves the use of their energy and oxygen use too. Okay, and also when they eat too much large food, now the stomach is so full, and that can also inhibit breathing. That can make the breathing difficult. Sometimes even when you are very full, you find it difficult to breathe. Exactly. Now let's go through the wrong choices. Drink liquids with meals. If they drink liquids with meals, it would actually make them very full and make it difficult for them to breathe. So and when they feel very full, it can worsen the dyspnea they are feeling because it's difficult breathing. So they should actually drink water when they are done eating. Eat large meals to conserve energy. Large meals actually increase oxygen use. How are you conserving energy through eating large meals? It's not matching, right? And D, limit fat and protein. They need high calorie, so they still need healthy fats and protein too. Okay, so the best dietary instruction is to eat small frequent meals in high calories. If this video has been helpful to you, if you've enjoyed this review, please don't forget to give it a thumbs up, subscribe, comment. I will be reading it. Thanks for your support. Now the last one, guys. Yay, we made it. Which statement by a COPD patient indicate the need for further teaching? Wrong statement. We are looking for wrong statements. I'll use my rescue inhaler before exercise. I need to avoid crowds during flu season. I'll stop my medication if I feel better. I'll get my yearly flu shot. Now, all of the statements are right except C. I'll stop my medication if I feel better. In COPD patients or in any medication you are taking, never stop abruptly. Never stop your medication because you're feeling better. All of the other teachings are very correct, are appropriate statements. Thank you guys for watching. Bye.